Goni scale ankle plantar flexion talocrural joint. Position the patient sitting with the knees flexed to 90 degrees. Make sure the foot is in 0 degrees of inversion and eversion. Be sure to test the unaffected limb first. In patient-appropriate language, ask the patient to plantar flex. Assess the tibia and fibula to prevent knee flexion and hip rotation. Use one hand to move the foot into dorsiflexion by pushing on the dorsum of the foot. Do not exert any force on the subject's toes and be careful to avoid pushing the ankle into inversion or eversion. As you stabilize the tibia and fibula to prevent knee flexion and hip rotation, the end of range of motion occurs when resistance is felt and additional motion causes knee flexion. Assess the end feel of the joint. This should be firm because of the tension in the anterior joint capsule, the anterior portion of the deltoid ligament, the anterior talofibular ligament, and the anterior tibialis, extensor hallucis longus, and extensor digitorum longus muscles. The end feel may also be hard due to contact between the posterior tubercles of the talus and the posterior margin of the tibia. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the lateral malleolus. Align the stationary arm with the lateral midline of the fibula, using the head of the fibula for reference. Align the movable arm parallel to the lateral aspect of the fifth metatarsal. Be careful not to use the head of the fifth metatarsal as a reference. Palpate the entire lateral aspect of the fifth metatarsal to ensure you get an accurate measurement. Ask the patient to perform ankle plantar flexion as previously done, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the hip and knee. Read the degrees of motion on the goniometer and then ask the patient to return the leg to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document in the patient's chart. The average range of motion, according to the American Association of Orthopedic Surgeons, is 50 degrees.